Doctors are now issuing a quiet but urgent message to senior men and women everywhere. It is not about surgery, it is not about prescription drugs, and it is not about expensive supplements. Instead, it focuses on something far more ordinary, something sitting quietly in kitchens around the world, often overlooked and underestimated. According to emerging research in neurological aging and ocular health, what you drink before bed may determine how well your eyes see and how clearly your mind remembers the next morning. The warning sounds almost too simple to be true. If you are over 55 and your vision is fading, or your memory feels foggy, the problem may not be your age, explains Dr. Alan Peterson, a neuronutrition researcher. It may be that your brain and eyes are starving overnight when repair and regeneration are supposed to happen. This realization came during a sleep metabolism study involving adults between the ages of 60 and 82. Researchers noticed something striking. Participants who complained most about blurry vision, poor night sight, forgetfulness, and mental fatigue all shared one habit. Their evenings were nutritionally empty. They went to bed hydrated but depleted, giving their bodies nothing to rebuild with during sleep. One patient, Eleanor, age 74, described waking every morning with dry, tired eyes and a sense of mental dullness that lingered until afternoon. She misplaced words mid-sentence. She struggled to recall names. Reading had become exhausting. Doctors initially told her this was normal aging, but her brain scans and eye exams told a different story. There was no severe disease. There was deficiency. What science now confirms is that aging eyes and aging brains are not simply wearing out. They are becoming undernourished at the cellular level. During sleep, blood flow shifts toward repair pathways. Neurons clear waste. Retinal cells regenerate. Memory consolidation takes place. But without the right nutrients circulating, these processes slow dramatically. This is where the concept of therapeutic nighttime juices enters the conversation. Not sugary fruit blends, not bottled drinks, but targeted natural juices designed to deliver specific compounds the brain and eyes require during sleep. Doctors have now identified 4 juices, when consumed in small amounts before bed, that consistently support sharper vision, stronger memory, and clearer cognition in seniors. These juices work not by stimulation, but by restoration. The first juice doctors recommend is carrot and beetroot juice. Carrots are famously rich in beta-carotene, which the body converts into vitamin A, essential for retinal health and night vision. But what surprised researchers was the role beetroot plays in this combination. Beetroot increases nitric oxide production, improving blood flow to the optic nerve and brain during sleep. In clinical observation, seniors who drank a small glass of fresh carrot beet juice 3 to 4 nights per week reported improved contrast, sensitivity, and reduced eye strain within 2 weeks. Many noticed fewer floaters and better low-light vision. The memory benefits came from enhanced oxygen delivery to the hippocampus, the brain's memory center. One retired engineer reported that he stopped forgetting why he walked into rooms. Another woman said she could read for longer periods without losing focus. These were not dramatic overnight changes, but steady, noticeable improvements. The second juice is blueberry and grape juice, specifically dark grapes. Blueberries are rich in anthocyanins, compounds known to protect neurons from oxidative stress. Grapes contain resveratrol, which supports brain plasticity and slows age-related cognitive decline. What makes this juice powerful at night is its ability to support memory consolidation during deep sleep. Studies show that anthocyanins cross the blood-brain barrier and reduce inflammation in memory circuits. Seniors who consumed this juice before bed demonstrated better word recall and improved short-term memory after just 3 weeks. Vision benefits were also observed. Blueberries enhance retinal signaling, making visual processing faster and clearer. Many participants reported that colors appeared brighter and reading felt easier. The third juice is spinach, cucumber, and green apple juice. While not sweet, this juice is one of the most powerful for protecting vision and cognition. Spinach contains lutein and zeaxanthin, antioxidants that accumulate in the retina and protect against macular degeneration. Cucumbers provide silica and hydration without sugar spikes. Green apples add quercetin, which supports neuron communication. Doctors emphasize that this juice should be lightly blended and strained, not thick. The goal is gentle absorption during sleep, not digestive burden. Seniors who use this juice consistently experienced reduced eye dryness, fewer headaches, and improved mental clarity in the morning. One participant described waking up feeling mentally clean, as if the fog had lifted. Another noticed improved balance and spatial awareness, a sign of better visual brain coordination. The fourth and most surprising juice is pomegranate juice, diluted with water. Pomegranates are rich in polyphenols that protect brain cells from aging-related damage. They also improve blood flow to the retina and reduce inflammation in ocular tissues. In sleep studies, seniors who consumed diluted pomegranate juice before bed showed increased brain-derived neurotrophic factor levels, a key molecule involved in memory formation. Over time, this translated into better recall, sharper thinking, and improved learning ability. Vision improvements included reduced glare sensitivity and better visual endurance. Seniors reported less eye fatigue when watching television or using digital devices. Doctors stress that timing is critical. These juices should be consumed 60 to 90 minutes before sleep. This allows insulin levels to stabilize and nutrients to circulate during the early stages of sleep when repair mechanisms activate. Portion size also matters. More is not better. A small glass, about 120 to 150 milliliters, is sufficient. Overconsumption can disrupt sleep or digestion, counteracting the benefits. Another key factor is rotation. Doctors advise rotating these juices throughout the week rather than consuming all 4 daily. This prevents nutrient overload and keeps the body responsive. It is also important to understand what these juices are not. They are not cures. They do not reverse advanced disease, but they significantly slow degeneration and restore function where decline is driven by deficiency rather than irreversible damage. Many seniors mistakenly rely on eye drops, memory games, or caffeine to manage symptoms. While these may offer temporary relief, they do nothing to nourish the cells responsible for vision and memory. Real improvement requires cellular support. Dr. Peterson explains, your brain and eyes are living tissue. They respond to what you feed them. During sleep, they are most receptive. That is when nourishment matters most. There are also important warnings. Seniors with diabetes should monitor blood sugar and consult their doctors before adding fruit juices. Those on blood thinners should be cautious with pomegranate juice. Natural does not mean risk-free. Despite these cautions, doctors agree that for most seniors, these juices offer a safe, accessible way to support cognitive and visual health without medication. One of the most profound benefits observed was emotional. As memory improved and vision sharpened, confidence returned. Seniors felt more independent. They engaged more socially. They worried less about decline. A 79-year-old participant summarized it simply, I feel more like myself again. I trust my mind. I trust my eyes. Doctors emphasize consistency over intensity. Small changes practiced nightly compound over time. Within weeks, the difference becomes noticeable. Within months, the benefits become protective. What makes this approach powerful is its simplicity. No pills, no invasive procedures, just targeted nutrition delivered at the right time. If you are over 60 and notice your eyesight dimming or your memory slipping, the message from doctors is hopeful. Decline is not always inevitable. Sometimes your body is simply waiting for the right support. Your brain repairs itself while you sleep. Your eyes renew themselves in darkness. Give them the tools they need, and they respond. These 4 juices represent one of the most overlooked strategies in senior wellness today. They work quietly, gently, and effectively, aligning with the body's natural rhythms rather than fighting them. If this information resonated with you, consider sharing it with someone you care about. Vision and memory are deeply connected to quality of life, independence, and dignity. Thank you for reading, and stay connected for more science-based guidance designed specifically to help seniors age with clarity, confidence, and strength.